Hey, I am your therapist if you are dealing with perimenopause, menopause symptoms, and getting frustrated with healthcare. My name is Brenda Bryson. I own Monarch Physical Therapy in Fredericksburg, Texas. I have been a PT for 29 years, and I own a myofascial release clinic. And so in my work life, I have worked for years in acute care and inpatient rehab. So I have a real passion still for spinal cord injury, traumatic, whatever. There's just so much rehab stuff instilled in me from when I was a young therapist. But for the last 22 or 3 years, I've been taking myofascial release classes, which is really helpful in creating space in the body and helping people in pain. So everybody's in pain. We all have systemic pain. So I deal with a lot of bizarre pain presentations. People who've gone to therapy before have something strange, so they wind up, oh, go see Brenda. She'll help you out, which I do. But that also includes a lot of pelvic floor PT. So that's a whole other subset of PT. Like I've already niched down. Well, the pelvis. Physical therapists deal with muscles, and there's lots of muscles in the pelvic floor. And so that's the oversimplification of that. But I'm so excited in healthcare right now that there are so many great physicians speaking out against ways to help women and their pelvis do better. So whether it's things like vaginal estrogen and helping decrease urinary frequency and urgency. If you know a pelvic PT, we have lots of samples. So there's lots of brands. Kendra is one. They give us all samples. So it's worth trying. You know, some of these lubricants are silicone-based, some are water-based. There's my favorite standby slippery stuff, which is basically water in a lubricant form. But there's all kinds of great things just to have great conversations with. It's so challenging to find caregivers in your area, healthcare professionals that either have time or have the interest that you feel safe enough to discuss these things with. So I have said for years, you know, hey, invite me to your book club or somewhere where you'd want to have these conversations with a bunch of women. Nobody does that. So I'm just here as an educator, okay? There's no way I'm going to be able to see everybody on the planet who has all these types of pain, but I want you to know there are great resources out there. Dr. Haven, she has lots of menopause information, educational stuff. Look up Dr. Rachel Rubin. She is a urologist in the Metro DC area, but on her website, so RACHEL RUBIN, she has great downloads available that you can just talk to your physician and come in with a printed out PDF that says, hey, this is what I'd like, let's have this discussion. And so I am a Gen Xer, and I feel like sometimes I don't have the best words. And I get frustrated. And when you combine that with hormonal changes and some brain fog, it's hard enough to stay on track and not be overwhelmed. But I just decided to use this platform for a little more education. Obviously, men also have hormonal changes, and I'm not excluding them, but I'm pretty much here talking to the 40 and 50-year-old women who have a lot of changes coming. That's affecting their soft tissue. It's affecting your mobility. But root cause. Try and go back to the source and see how some of these things can help. And just start having these conversations. So I will put the link to Dr. Rubin's website in the comments, and I'm open to discussion, but just kind of starting the process here of, I try not to call myself an old physical therapist, but a seasoned one. Just experience. And so let's have these conversations in a safe space that invites conversation, so that you can do some research and also feel more comfortable talking to your physician. Another resource that I have found that I'm kind of in love with is an app called Superpower. And so it combines functional medicine and AI. And I am really surprised how much I love talking and chatting with the Superpower chat. So you can upload labs, they can draw labs, you can chat at any time of the day or night and talk about your symptoms, and then they're reviewed by a functional medicine physician and come up with a protocol. They also have physician grade supplements within their marketplace, so it makes it easy to schedule supplements that your lab work shows you may need. It gives you research articles to help determine, why would I need selenium or vitamin K or whatever. So you have a really good understanding of what you need, why you should be taking it, and then prompts for when you go to your physician, here's some things to ask them about. Like maybe you don't want to take a statin drug for your high cholesterol, but you found this other supplement and you have questions about some of your labs. Great. Now you've done your research, you can print out information, and you can have the conversation that you need with your healthcare provider. I love it. So it really surprises me how much I like talking to the AI platform, but I can do this when I'm thinking about it. If I don't have the bandwidth in the evening, I can do it first thing in the morning. It's simple. So anyway, I will also, and I'm not sponsored by any of these people. Like, I'm just a therapist that asks questions and have reached out and gotten samples or whatever along the way. So I'm just here as a way to educate. And if you have questions, please let me know. And as always, we're in this for the long haul. So let's try and age well and have fun in the process. Okay, peace out. Bye.